Good afternoon, Foundations class. This is my first live recording of the year because we have a new textbook. So I am excited to bring you new content, and I am activating my webcam this time so you can see my face as well. This is Chapter 7, Working with Managed Care and Third-Party Reimbursement. I love that this text has this chapter because I think it's so important. I don't know why my PowerPoint's not. Oh, there we go. Okay. There we go. I'm just seeing what's going on there. So I don't know. Again, I love this textbook because our last one didn't really talk about this, but of course, managed care is basically insurance. It's really an umbrella term that describes the oversight of the healthcare system. And the reason that we have managed care is because several bills that were passed in the 70s and 80s because prices were becoming outrageous. If you ever look at your hospital bill or the itemized breakdown, you can see sometimes you could be charged $1,000 for, say, a Tylenol. So these managed care systems are supposed to keep the cost of medical care down and prescriptions, etc. These managed care systems, they negotiate contracts with healthcare providers and hospitals to keep the fees down. So you agree upon a certain price that you'll pay. We too do that as clinicians. We can negotiate for a fee for service. So we did not have access to just ongoing mental health managed care payment until the Affordable Care Act in 2010. And what the Affordable Care Act did was really expand Medicaid and not have as many limits on coverage for mental health, opening up the access of mental health for longer term treatment. It's really distracting having my face, so you guys will have to tell me if you like me having me on here or not, but I find it a little distracting. I keep looking at myself, and of course there's a lawnmower outside when I'm trying to record. Let me pause this until that passes. Okay, the lawnmower is out. It'll probably come back because lawnmowers go back and forth, so we'll try for a minute. So there are 4 types of managed care systems. There's an HMO, a PPO, a POS, and an EPO, and those are some of the ones that you're familiar with. They're the main ones, but an HMO is a health maintenance organization. And basically, they're just different types of coverage in managed care systems, and they mean different things. So when you get insurance, you may have an HMO plan or a PPO plan or a POS plan or an EPO plan. And I'm going to talk a little bit about those. It's important that you understand this because at some point, if you're going to make money in our field, you'll need to take insurance and you'll need to understand how this works. So it's a long time before that happens. You have to graduate and become an LPC to take most insurance, but still, at least you'll have an idea. So for the HMO, the primary point of contact is your doctor, your primary care doctor. Then you need a referral for outside services. You can only use contracted doctors in your network. It can be challenging if you have some kind of condition that needs out-of-network care. The next one is exactly what it says, Preferred Provider Organization or PPO. If you want to remember by preferred provider, you have more flexibility in your choosing of your providers, your doctors you want to see. And that's important for a lot of people because they don't want to be pigeonholed into just being able to see certain doctors in network. There's also a point of service, which is similar to HMO. You have to have a primary care doctor that serves as kind of the point of service gatekeeper for all referrals. Also, a negative about this one, your deductible must be met before paying for out-of-network. So if, for instance, you had cancer and you needed to go to an oncologist, you wanted to see an oncologist out-of-network, you would have to maybe pay $4,000 or $5,000 to meet that deductible before your benefits would kick in for an out-of-network provider. And then exclusive provider organization and network. I can talk a lot about this one because as a clinician, where this affects us is this way. Wellstar in LaGrange is an EPO. LaGrange College used to be an EPO. We had our own, you had to see the people that they contracted with, period. And that is kind of what Wellstar is. So Wellstar, while they have Cigna as their managed care insurance carrier, they have an EPO with Cigna. So what can happen here as a clinician is you may take Cigna, but because they're an EPO, you're not in network with that provider. So for Cigna, for the WellStar, they used only in-house other WellStar clinicians, and we were not in network. So our WellStar doctors, nurses, etc., during this critical time where those health service workers need counseling, weren't covered, and we're paying 100% out of pocket. Now, being able to maybe build that back and get some sort of the deductible in some cases. But just wanted to give you an idea. We've been fighting to get in network. I have to check on that, and I'll let you know. So the way that you get in network with an insurance company is an arduous process. It's not just an easy process to get credentialed, and that's what it's called. A lot of times you'll hear providers say getting credentialed, and that can mean a couple different things, but it typically means getting credentialed. Your credentials are all checked and getting credentialed in on panels, insurance panels. First of all, most of the time you have to be an LPC or an LCSW so that you can apply to be credentialed by the insurance panels like Blue Cross Blue Shield. The way you do that is by following a series of steps. I went ahead and said first, you would ordinarily already have malpractice insurance. You get this in graduate school. When you start practicum, you have to be covered by liability insurance in case something happens, and you keep that throughout your career, but you have to have that. You get a tax ID number used by the IRS. It's a very simple process that you go online and do. You apply for an NPI number, which is a national provider number, and it's because of HIPAA. This is a health identifier, and you have to have both of those before you can go any further. Then you have this huge database called CAQH, and it's a pain. You create a profile in CAQH, which is really wants everything in your entire life that's ever happened to you. I mean, you have to upload documents and prove that you had your supervision and prove that you have your license and prove, honestly, I can't even remember it so much. But you create a profile and you fill out all of this information. It's kind of like filling out a FAFSA. If you ever fill out a FAFSA, that's what it kind of reminds me of, but more detailed. And that links to the insurance credentialing, and that's the only way to do it. So there's no other way to do it. So once you do that, then you get linked with the different insurance companies that you want to be credentialed with, because you don't have to be credentialed with anyone. You can negotiate rates with certain companies and say, I'm not going to take Cigna, but I'm going to take Blue Cross Blue Shield, PPO. So you have some power in that process. Once you get on those panels, you're on the panel, and then you have certain things that you have to do to get paid. I think I just talked about this, but one of the negative things is that something must be wrong for you to get paid. So you have to give a diagnosis, and so it can be really tough not to downcode or upcode in a diagnosis so that you can get paid. But if you don't have a diagnosis that gets you paid, you won't get paid. and then they can't come to counseling. So you have to use assessments, but you also have to be smart with your diagnosis. You can get in trouble for upcoding or downcoding. So you want to be at least somewhat clear about what you're putting in your software. Usually some of the managed care organizations require you to pre-authorize services. So that's usually done by my office staff, but that's something sometimes individual providers do on their own. And you have to have a diagnosis. And I just talked about that. You have to, in order to get paid, you have to diagnose. And we're going to talk about this when we meet, but just be thinking about your philosophy and what does that mean for you and how do you feel about that? And most people can meet the criteria for generalized anxiety, mild, moderate, or severe. Most people can meet a depression inventory, mild, moderate, severe. A lot of people have a PCL5, they have a PTSD score, but those are all paid for. And sometimes an adjustment disorder also paid for. That's a safe route to go. A lot of times if you really don't think they meet the criteria for a lot of the general disorders, that can be a really good one to use, especially for me because of EMDR, because sometimes it's just a recent event that's caused an acute stress disorder. So then you either pre-authorize a client, you start seeing the client, then you have to have some kind of, I may have said this, but you need some kind of software. I don't know if I put that in here or not. I don't know that I did. I didn't, but at some point in here, you would need to get some type of software if you're going to take insurance. I mean, it's just easier. I use Simple Practice. You can file claims in Simple Practice. It's just pennies to do it in there. Everything is linked, and you put the diagnosis in, and you can file the claim. It must be done within 30 days, and what is in a claim, an insurance claim, is just what it says here. Your patient demographic information, insurance information, provider info, which is you, provider ID, tax ID, and MPI, business tax ID, date and place of service. If you did a telehealth, if you conducted it via telehealth, it must be notated if it's not in the office. And there's certain things you have to do for a telehealth session that are different than an NC at your office session. You must have a diagnosis, procedure codes, and charge for the services rendered. Claims are usually paid within 30 days, so when you first start taking insurance, you can have a pay lag for at least that time. Then once the checks start coming in, you stay consistently paid because you're constantly filing claims. So you're constantly getting checks in and getting paid. And we find that the turnaround is quite quick for our office. You also are subjected to audits because you have to keep your records in a certain manner and you have to get clinical case notes. We started talking about this last time we met. I think we ran out of time. So when we meet next week, we'll spend some time talking about notes. You will hear about notes throughout the entire program, but a clinical case note is how you record the session. One of the most popular is a SOAP note, and that SOAP stands for subjective, objective, assessment, and plan. And if you're audited by an insurance company, they're going to come in and look at your software, look at your diagnosis, look at your assessments, look at a treatment plan, look at your clinical notes, and want to see that they're actually written in a format that you're first of all taking notes. You'd be surprised how many people don't, clinicians, and second of all, that they are following some type of format or referencing back to a treatment plan. And what those clinical notes stand for: subjective is what's reported by the client and the counselor. Objective is what is observed. What are you seeing? What do you hear? What do you kind of view? Mental status exam, it could be some of the things that you observe. And the assessment is actual assessment inventories, depression inventory, etc. And then what's your plan for the future? Oh, I was going to talk about that. I don't think you need to know anything else about this chapter. There are disputes, so you have to go back if a claim isn't is denied or something of that nature. You have to go back and fight it. I find it best for me. I have someone who does this for me. But if you're just starting out and you're on your own, you would have to be the one negotiating and going back. Sometimes it's just as simple as you put something in a wrong space or you coded something incorrectly. It's often a quick fix, but it can be quite a pain and quite time consuming. So it's nice to have people that can do that for you. Well, there wasn't much to this chapter, but we sure are going to have a lot to do when we meet to talk about these two chapters.